Thank y'all so much for coming today, making time in your busy schedules. I think we can dive right into a little bit of an introduction. If y'all don't know me and Kim, I'll introduce myself. My name is Annie Schwartz. I'm a clinical nutritionist here at CHP and have the honor of being the Size-Inclusive Care Coordinator here at CHP. And I'll let Kim introduce herself.
And I'm Kim Loring. I'm a psychiatric nurse practitioner. I work primarily with child and adolescents at CHP, but also in opening my panel for adults who are looking for size-inclusive care psychiatry prescribing services through our model at CHP. This is a great picture of me and Annie. Shout out to our Berkshire's Body Liberation Hiking Club, Outdoors Club, which I see some other club members on here. This is from one of our hikes.
And we are honored to be here. So I think when we were talking about how we wanted to start this conversation with y'all, we decided that we wanted to start with just like kind of defining what weight stigma is, because size-inclusive care is really an approach that was created to address weight stigma. So feel free to share, in the chat. I think we're going to be like offering some opportunities to throw things in the chat if y'all feel called to on, what weight, like the definition of weight stigma you think it is. I think there are many definitions, one of which, we've used in the past is, weight stigma has many names. It could be weight bias, weight-based discrimination, but essentially it is discrimination or stereotyping based on a person's weight or size, right? We can use weight and size interchangeably here. Weight stigma can show up in a variety of settings, including healthcare, which we're really here to focus on today, but it can also show up in education, in employment, and just more generally, in social interactions, right? So then let's take it to focus on healthcare, and I'll hand it over to Kim.
So some specific ways that that weight stigma can show up in healthcare listed here on the slides. And some of you may have your own stories that if you're willing to share, that would be terrific. But also traumatizing, right? So take care of yourself. If there's a sense or an awareness, or what research has shown that healthcare providers can make assumptions about person's lifestyles or eating habits based on the size of their body, presumptions about the causes of illnesses or injuries based on the size of their body, ignoring other symptoms or other issues that could be going on. And then simple sort of practical facilities, things that make people feel unwelcome or not considered, or make the area inaccessible. Sizing of chairs in the waiting room, companion chairs in the exam rooms, exam tables that can't go up and down or fit different size bodies. Blood pressure cuffs. Having a blood pressure cuff that's too small will make your blood pressure reading higher, leading to false diagnoses of hypertension. So different things like that. Does anyone have any sort of specific things that have shown up for them when they've been seeing a healthcare provider that have made them feel sort of othered or not welcome? Oh. There's a comment in the box about pneumonia for a full month at age 15 because doctors kept telling her that they were overweight. So I certainly know people who have, put off or discussing with their doctor, people, shortness of breath or trouble breathing because they either internalize their own weight stigma and feel like it's because of the size of my body and that I'm overweight, or because they feel like the provider will make that assumption also, or in fact has told them that. So, and breathing is important. So it's good to be able to talk to your doctor about it.
Yeah, and these are just a few examples that, we put together. I think those examples are really sort of innumerable. Again, I think this is why Kim and I are so excited about this and to be talking about this with you today, because it's so needed. Whether it's sort of, the impact of weight stigma leads you to avoiding or delaying care, or just not being able to get appropriate care for what you're coming to a provider with, right? It's really wide ranging. And I see a few more in the chat. Yeah, the impact is really significant. Okay, so what comes next? Oh yeah. Kim, do you want to take this one?
Sure. So I think specifically, weight stigma can impact people's health by increasing their stress response, their cortisol levels, things like that. So things that we know based on research is that elevated stress influences, can worsen people's mental health, causing anxiety, depression. Increased stress affects your heart health. Increased stress, in fact, changes hormone releases and impacts your metabolic health. And then physical health. So certainly, having getting different messaging from diet culture, biased professionals around food choices and activity, unsolicited advice from people at the grocery store about what's in your cart, like impacting the food choices that you would naturally make to take care of your body, can have a big impact. And certainly even just from the stress of thinking about going to the doctor and getting weighed and avoiding healthcare because of that is a huge, impact on people's health because they're delaying care.
Yes, so much. And so I think our next slide is a really nice tie-in because now we've defined what weight stigma is. We've defined how it shows up in healthcare, what that can look like for us as patients, and how that impacts our health as well, right? Not just how it shows up in healthcare settings. So what are we doing at CHP to address it? So first, this was kind of a renegade little grassroots offering. Kim and I sort of knew each other from a training years prior, and then found out that we were both working at the same organization, and were really overjoyed to find out that this was really supported here through, I have to shout out Andrew Beckwith, our amazing chief medical officer. He saw what we were doing and really believed in it and supported us, which is, really the reason why we're able to be here today on behalf of CHP for y'all. But we were able to form an incredible committee of other passionate folks that really felt the same way. And I'm going to do some shout outs because y'all are amazing. Tatiana Falwell, Jeff Quinto, Sammy Harrison, Dr. Lisa Nelson, Laura Garapi, and more. I know I'm missing people. Jen Rubino. There's just an amazing group of folks on this committee with us. That we wouldn't have been able to bring these offerings to you without their support. So what we've been doing behind the scenes with all of this support is doing a lot of training and education. We've been doing book clubs. We've created an internal resource hub for our staff, and we have done at least one grand rounds at this point. We hope to do more to continue to bring this information to folks. And we created a universal consent to weigh workflow. So across any office at CHP, you will have the opportunity to decline to be weighed, ask for a blind weight, or agree to be weighed. That is your choice. And we just want to reinforce that for y'all. And we've had the opportunity to launch the Size-Inclusive Care track that we're going to be talking about with y'all a little bit later in this presentation. We have some incredible providers signed on to provide size-inclusive care. And I mean, yeah, we're really so elated about these offerings and talking about a group that Kim and I will be running and starting next week. So we'll tell you more details about that a little bit later in the presentation, but we're really excited about all of these ways that we are working to address weight stigma in healthcare at CHP. Kim, you want to?
So yeah, so sort of, expand or explain more about what size inclusive care is. Sort of our guiding values are recognizing and to respect the diversity of body sizes. People of all shapes and sizes have always existed and they always will. There's not a goal of making people's bodies smaller, which means that their bodies are better. We don't believe that. We want to prioritize equitable, compassionate, and evidence-based care, regardless of body weight or size. So, for example, is this something that you would recommend as a treatment if I were in a thin body? Or what do you recommend for patients who are thin? I think about, someone in the chat who mentioned putting off referrals for sleep study or for physical therapy because, of the realistic, real life concern that the treatment recommendation will be just make your body smaller. And the next step of that is like, well, what's the evidence base for saying that making your body smaller and dieting and losing weight is like a good long-term treatment? Because research shows that it's not. So we're really trying to get away from, we really want to separate the size of our bodies from our health behaviors, right? So much improvement in health, if that's what you're interested in doing, can be done without changing the size of your body at all. You can improve your cardiovascular system, height, metabolic system, diabetes, blood sugars, hypertension, things like that, all by just increasing certain health behaviors if that's something you're interested in. And even if you never get smaller, your body never gets smaller, your health still improves. So that's really what we're trying to help people. Losing weight is an outcome, it's not a health behavior.
So well said, Kim. So we wanted to also just talk a little bit more in detail about some of the benefits of size-inclusive care, taking the focus away from weight. We really see a ton of benefits with this approach on the clinical side, like Kim was saying, like holistic approach to health is really looking at the whole person, right? We see enhanced health outcomes. We see more sustainable behavior change, right? Because when we're focused on seeing a change in our bodies, if we don't see the change we're hoping to see, we often don't stick with those health behavior changes that we've made in an effort to change our bodies, when really they are beneficial regardless of whether we see changes in our body or not. And same with positive impact on mental health. I know someone mentioned, getting the recommendation to exercise as an antidepressant. And I think that's a really great example of how we frame sometimes health behaviors as a way of sort of impacting our mental health in a way that might not actually be as supportive to our mental health as we're told, right? It has other impacts on us. So I'm going to let Kim take it away on the next slide.
Sure. So this slide, one side, diet culture, to be healthy, eat less, exercise more. And then we actually know, especially working in community health, fairly qualified health center, working with people of all, socioeconomic areas and resources, like there are so many more things that go into your health than the size of your body. And there are so many things, the majority of which we actually have no or little control over. So it's tempting, I think, as providers to be like, here's a little part you can control, change how much you eat and how much you exercise, and that will make a big difference, when in fact, there's all these other things happening in the background. They're just completely not being addressed. And so, for example, that, the person who mentioned the need for an SSRI because exercise was a great antidepressant, right? So it sounds like, sometimes as providers, we're missing like doing the assessment piece. Well, how much are you exercising? Are you eating vegetables? And there's an assumption based on the size of your body that you're not doing any of those self-care behaviors, when in fact, no one even asked, right? So genetic stress, oppression, financial resources, huge impact on people's health. And all the green smoothies in the world won't fix that.
Yes. Yeah. And so we wanted to, to talk about health behaviors. We think this study in particular is really, really helpful to sort of illustrate that it's really, if we look at the big picture, there's really just a few things that flatten the sort of typically associated risk with larger body sizes, right? If you'll look at like from between 0, 2, and 4 habits, I really like to use the difference between 0 and 2 of those habits, because it pretty much flattens the playing field, right, between groups. And I will note that while this study uses BMI, and we don't think of BMI as any indicator of your health status in any way, shape, or form, it is unfortunately what research uses at this point. But often we actually find, even when they use these terrible metrics, it's a great way to point out how flawed it is. So you might be wondering, well, these healthy habits, they might be like a really big lift, right? Not so much. So the first 2 habits are not smoking. That is literally one habit, just not smoking. And the other is alcohol in moderation, which typically the measurement for that is 2 drinks a day for men, 1 drink a day for women. Again, just those 2 things flattens a risk that's typically associated with body size. Okay. If we go to 4 habits, the other 2 habits are 5 fruits and vegetables a day and physical activity a little more than 12 times a week, right? Or a month. Oh my God. Y'all, can you imagine? No, 12 times a month, which works out to like 3 times a week. Okay. And even the physical activity piece, the measurement they used for this is really limited. Okay. This is not a, a big move, right? So already your risk is flattened with 2 and even more flattened with 4, right? So again, I think this is just one study that illustrates that when we look at the whole health picture, it's really not about weight, it's about health behaviors, and that these health behaviors support us regardless of, where our calculated BMI may fall on this scale, okay? That is really what we're trying to illustrate with this slide, and I hope that comes across. Yeah.
So I wanted to take a minute sort of specifically to address some of the mental health issues around weight stigma and why we're really trying to provide a more supportive, compassionate healthcare practice here at CHP. We do have a specific concern around the explosion of number of eating disorders that people have, young people. Since the pandemic, doing a lot of trying to work on eating disorder prevention, and a lot of that is sort of identifying and challenging the diet culture beliefs about the size of your body, and having people sort of be able to tune into what their body needs and accept what that looks like on a day-to-day basis. And sometimes it's different depending on how things are going in health, but really having some self-compassion around your own self-care and making choices for yourself that meet your own determined needs for health goals. And I also hear a lot from people whose bodies are changing, and I work in child and adolescents, so kids' bodies are changing, from 0 to 28 or so. And then as we get older, our bodies continue to change, right? So being able to accept that bodies change and that's normal for bodies or typical for bodies. And how do we accept that about ourselves? And how can we accept that, things are getting bigger, things are getting smaller, and that's still okay. And you're still a worthy person and you're still worthy of compassionate healthcare.
So how will my healthcare visit be different if I opt into the size-inclusive care track at CHP? I think it's hard to capture everything that might be different but we're going to take a stab at it, okay? things like your medical concerns will be respected regardless of your size, right? Your symptoms won't be automatically attributed to weight alone, right? Your provider or the staff working with your provider will seek your consent to be weighed. You won't be made to feel like you need to lose weight to earn care. Your provider recognizes the diversity of body sizes, like Kim was talking about earlier, and how that doesn't have the same impact on health as we've been told it does, right, in the past. You won't receive unsolicited weight loss advice. Your provider won't assume you're eating or moving in a certain way because of your body size. Your provider will look for consent before offering, any sort of like nutrition or physical activity recommendations. They will do a thorough assessment, like Kim was talking about, right, to understand what you actually are doing, right, and figure out what might actually, if anything, be helpful to do differently to support your health. So that, I mean, and I think I can, speak for everyone where I say there's also an emphasis on self-care and self-compassion, right? It is hard to exist in this world. It is hard to exist in a body in this world. And we get that. Okay. So what's next? Where is size-inclusive care at CHP? Ah, okay, great. So elated to share that well, first, let me say this is the size-inclusive care offerings at CHP. We are modeled after the size-inclusive care health offerings at Thunder Mist in Rhode Island. And there is a double opt-in here. So both patients and providers opt in. Patients opt in to receive size-inclusive care, and providers opt in to provide size-inclusive care, right? We believe that the double opt-in model is really helpful for setting that intention between patient and provider, and creating that space so that patients feel empowered to say what kind of care they want to receive, and providers are ready and waiting to listen to how they can best support their patients in this way. So now, who is providing size-inclusive care at CHP? It's a great question. I'm excited to share primary care providers at every single site at CHP. So from North Adams to Great Barrington and Barrington OBGYN, we have at least one size-inclusive care provider at every site. Kim Loring is going to be your source for mental health support. I'm going to be your source for nutrition support. And again, shout out to Andrew Beckwith, our amazing CMO, is available for your OB/GYN care needs. And also Jen Rubino is there for your GYN care needs. And then we have our group. So we will be meeting, the group will be meeting on Wednesdays from 5 to 6 via Zoom. And next Wednesday, we're sort of going to be hosting an open house. So if you want to learn more about the group, you want to know if it's something that you are interested in participating in, you can come on Wednesday from 5 to 6. Email Size-Inclusive Care at CHP Birchcrest if you want to come, and then meet us in the Zoom room on that day, and we'll be happy to answer more of your questions about that.
Just want to specify also, so the group support that we're offering is only for CHP patients. So if you are not a current CHP patient and you would like to be, call your local CHP site.
Yes, thank you so much, Kim.
And so if you don't have a size-inclusive care provider at CHP or at another practice, what kinds of things can you do to advocate for yourself with your own provider? Um, and I want to sort of like take a second to acknowledge the things that people have shared in the chat box, like really hard situations that they've been through, that have delayed care or impacted their health negatively because of the weight stigma, and not feeling comfortable to be honest and direct with their healthcare provider because of those preconceived notions that they have or the experiences they've already had with that same provider, right? So, you can certainly ask your provider when you check in and the medical says, put your stuff, like I just have my physical this morning, not CHP. Put your stuff down and then get on the scale. And I'm like, no, thanks, I don't get weight. And people are better at it now and accepting it, but it's a hard thing to speak up and say about. So it's not an easy thing. There are certainly, there's a little a graphic here about a company that has these please don't weigh me cards, can help explain that. I think people hopefully are getting better about it. There are certainly reasons to get weighed, certain conditions that people have, and it's good to be able to have a conversation with the provider about why it's important to know the size of your body or the change in the size of your body, right? So, for example, for pediatrics, we don't can ask small children if they consent to be weighed, right? We're part of pediatrics is tracking people's growth over time, and it's an important data point, not the only one that measures health, right? But one of the ones that we always check. So we are working on backwards weights for everybody, and just sort of having it be an opportunity. Parents who notice or kids who notice, oh, I do my height backwards, but now I do my weight backwards. Like, why the change? And having an opportunity to talk about health behaviors versus the size of your body and diet culture and all those kinds of things. Not that you have time for that in an appointment, but so you can certainly ask not to be weighed unless medically necessary. And you can also, a new provider like specifying with the front desk when you're making an appointment, this is an issue for me, and I am coming in for this specific reason. I'm not interested in talking about weight loss. I'm not interested in intentional weight loss. What are some other suggestions for how I can improve my health? And then there are a number of excellent resources, and we have a whole resource list. If you're interested, we can certainly send it out. And one of them in particular is Reagan Chastain's website. And it's very specific weight in healthcare. She's an amazing job of drilling down and pulling apart the current research, and discussing the issues around that and where it's flawed and it's not. So those are some options. I don't know if anybody else, I know someone in the chat box mentioned that learning from Annie that you don't have to get weighed at every appointment has made a big difference in the connection that they have with their primary care provider, and has really made them feel more seen and heard, it sounds like. So,
Kim, can I jump in for a second? It's Ellen.
Of course.
I just I stopped getting on the scale a while ago at the doctor's office, and I'm probably not somebody that you would look at and think, wow, she must have a weight issue or whatever. But I think this problem is for everybody sometimes. And so I just weigh myself before I go, and I report that when I get there, because then I know the scales is the same, each time. But also, I was also wondering for people who might want to have a conversation with their clinician, like, I really want to change my healthcare conversations with you, my provider. I want not to start out with my weight, or something. People sharing their experiences with their providers. Do people feel comfortable doing that, or is everyone just sick and tired of trying to get heard? What are other? I think it would be interesting if we could unmute for a second and see if anybody wants to say anything about some of these things that we've talked about so far. And let's take down the screen share for a minute. Just see a few faces. We've had a lot of good comments in the box, and wondering if any of you have kind of developed your own strategies for this, and if you'd feel comfortable sharing them with the group.
I see someone has their hand up already.
Stacy?
I know. Hi, Annie.
Stacy.
Hi, Kim. I usually see you guys hiking. So lovely. I just want to emphasize, I'm one of these people that for a very long time would either avoid the doctor 100% unless I had strep throat and I could just go to an urgent care and just get in and out. Because even when I did address my weight, the response I got from practitioners was not helping or healthy for me, which caused just for years of going back and forth. Even when I went to a doctor and they asked me specifically, what are my symptoms? I held back the majority of my symptoms because I was afraid that that was going to lead to a conversation of just focusing on my weight. And that's how I cycled through, I would say, the first, 40, 50 years of my life, really. And then it was really coming here, and I swear I'm not a plug and they didn't pay me to say any of this, but meeting everybody here, and my primary care physician asked me for consent the first time I came in here about 3 years ago to find a new doctor. And she asked for consent if she can introduce me to Annie to start with. Is that a conversation? And my first thought was, talking to a nutritionist is the scariest thing in the world. They're just going to tell me to diet. It was a completely different experience. That's where I learned that I could actually stop and say, no, I don't want to be weighed. And I've been respected throughout the process every time I've gone in for an appointment, unless it was something that was necessary. So I want you to know that that's a little step that takes a lot to say, and it's scary. And I've used that at other doctors' offices too. The other thing is, stay with it. It does not happen overnight. I still was building rapport with my primary physician. I was always holding back a little bit of things. And then one day I went in because my foot hurt. She goes, well, how long has it been hurting? I'm like, oh, about 2 years. And her thought was like, why didn't you come in? I'm like, because I don't tell doctors things. And to kind of fast forward, this all resulted in last fall me going in, and I'm comfortable sharing this. It doesn't have to be protected. That I came in with a concern. My doctor did not dismiss me. I asked for tests that I thought for sure she would say, let's focus on this one thing. And it ended up being thyroid cancer, treated so quickly. It was so helpful. And the only reason we got to that diagnosis and the only way that we got to that treatment is because I finally felt comfortable sharing all of my symptoms. I'm tired, I'm exhausted, all of these things they normally wouldn't do. So I know that this is really easy to say, just that this is out there and available, but it doesn't happen overnight. And I think that's okay. And that should be respected too. And take it when you can do it and the steps that can get you there. And I'm just so happy that I found a group that healthcare providers that actually really care about me. Is exciting. So yeah, that's my story.
Thank you, Stacy. Kim had her hand raised. Kim? Is it Kim? Okay, how about Lee? Oh, I'm sorry, Kim Clementi. Let's go back to Kim. She raised her hand first. Darcy, can you unmute Kim? Kim, can we hear you?
She might have stepped away.
Okay, how about Lee Rosenfeld? Lee?
Hi. I've been lucky also to work with this group for a few years and stumble into the right set of providers quite a while ago. And so I don't really remember the last time I got weighed, aside from a little bit in pregnancy, just to see how that was going. And everyone has been so supportive. I just wanted to say, what I've noticed is that even after having good care for so long, I still have a panic reaction every time I walk into a doctor's office. So I'm pretty much sitting in the waiting room, just trying to regulate, visualize, do deep breaths, a lot to calm myself. And so it's taking me this long to realize that probably one of the things I would start doing and recommend if you have any residual mental health reactions to this is I'd like to ask to have my blood pressure taken at the end of the appointment, because a long time ago someone was like, oh, you probably have white coat syndrome, and now I'm like, oh no, I was having a panic attack because I'm a fat person. So getting just in the room with your provider, assuming you have a safe one, and waiting to that point of comfort maybe to have that done. Because yeah, I just don't imagine, cuff aside, that you're getting good blood pressure readings if people are really anxious when they come in.
Who else had their hand up? Anyone else? I know that Kim Clementi is having trouble getting unmuted, and I want to be able to give her a chance to talk, and I'm not sure why it's not unmuting. Is there anyone else who would like to say a word or two about this? Okay, let's get back to the presentation. Please continue to share your thoughts, and we will have another moment to share at the end. So didn't mean to interrupt you, Kim, but I thought it might be fun to hear from people. So thanks. Kim, do you want to continue?
Yeah, I think actually this might be bringing us to our next and last perfect segue into more questions.
Spoiler.
Yeah. I'm also thinking about, Ellen, what you had said before about not seeming like someone who might have an issue about getting on the scale at the doctor's office. And I think, that's one of the important things that I've talked with people about who have been denied care or specialty care because of the size of their body. You need to lose a certain amount of weight before you will do this surgery or the fertility treatments or your knee replacement, right? So people who are thin have sleep apnea. People, in thinner bodies have diabetes. They have fertility issues. They need knee replacements because of their arthritis. And so I think sometimes I was talking with someone and they were just like, oh my gosh, you're right. Like I've got thin sister and thin parents and they all they're thin and they have bad knees too. It's not. And so that's where I don't think people always think about the reverse and how that they're actually, being treated under like a biased or a fat phobia sort of perspective when they're going to the provider and the recommendation is to lose weight. And the other concern I always have, and Annie, I'm sure has the same one as nutritionists, right? Like you're dropping a bunch of weight and then going to surgery. Like how does that impact your healing process, right? Like, are you malnourished, right? That's not going to be a good outcome for the surgeon either. So,
Yeah.
have we re-triggered your eating disorder? And now, your mental health and your anxiety and depression, because we've suggested that you need to be eating less and moving more. It's very worrisome.
I think this is also a part where, this is, I mean, we're so excited about what we've been able to create here at CHP, but it is just one small piece of the puzzle, right? There are a lot of things that, unfortunately, I mean, people who know me know I wish I had control over these things, but I do not, unfortunately, have control over like the surgeons in our area and the BMI cutoffs at hospitals. I mean, there's all of these really the weight stigma has penetrated every part of healthcare. So we are really excited to be able to be deconstructing this part here. But there is still a lot that we have yet to fully tackle. And I do hope that we have some opportunity to do some advocacy there on behalf of our patients, but it's still very present. Also,
Annie, oh, go ahead.
I just wanted to also mention that it's not lost on us that this is Eating Disorder Awareness Week. I think that this is an approach that is incredibly protective and a preventative approach for eating disorders, right? Because it is to be constantly told to manage or limit your food or increase your movement in pursuit of just being able to receive care really significantly increases the risk for developing an eating disorder, which is a life-threatening condition, right? So we are really also, again, just really proud to be able to offer something that is protective. Ellen, go ahead.
Hi, Annie, again. Some people on this call, obviously, some people are far away. They're not in the neighborhood, so to speak, which is actually great. And some people may already have other primary care or clinical.
Yeah. We don't want to interrupt you, but I think Kim Clementi just logged on. You might
okay.
be able to share.
All right, let's get Kim in here.
Oh,
Kim,
awesome.
you
Actually
should be
worked this time.
okay. Go ahead, Kim.
Perfect. I just wanted to mention that one of the things I have tried to do with doctors when they've focused on my weight is I have told them that well, I recognize that you would rather focus on my weight rather than the problem I came in here to discuss. I'd really like to refocus on my problem.
It's great. It's great. I would just like to note that Dr. Andrew Beckwith is CHP's chief medical officer, and he just is on the call. And I had a question for him and would like to call on him to chime in for a minute here if he's able. Andrew, can you hear us?
Sure. Yeah.
So Andrew, tell us it from your perspective in women's health. Everyone, Dr. Beckwith is obstetrician gynecologist with Barrington OBGYN, and he's been a real supporter of this initiative at CHP. So Andrew, how do you see this playing out with size-inclusive care? What do you think about this and how's it impacting things?
I think if you listen to what people are saying in this meeting and recognize the damage that's come from some of these approaches that medical providers take, that by continuing to have this conversation, we can, as physicians and nurse practitioners, there's this concept of first do no harm. And part of first doing no harm is knowing you're doing harm. And I think many of us didn't realize that some of the things that we thought we were doing in the name of better health were harmful, and making us aware of that and continuing these discussions and hearing what you have to say, what Kim just said, like, I think that's great. And I think if you're in a medical encounter with someone who won't refocus when you ask them to on something, you want to reassess whether that's the right provider for you. So these are all just ways that through time and effort and conversation and awareness that we'll get better at this. And I'm very confident that we will. And I'm looking forward to the benefits patients will have from a new world where some of this stuff doesn't go on any longer.
Thanks, Andrew.
Mm-hmm.
One other question I had, Annie, is for people who are far away or maybe not a CHP patient, will you be offering any other kinds of maybe book groups that are public, for people to join? Are there other opportunities that people can stay engaged with this topic through you and through this team?
We absolutely hope so. We don't have anything planned at this moment in time, but save, our webpage, get on our mailing list. You never know. I think that this will only grow from here. So I'm excited to see where that growth goes.
And I would say I would add, we'd be happy to share some of the resource lists that we have created for our internal providers, for our internal resources list with other people, and that's sort of outside organizations, helpful, books, websites, podcasts. We'd love to share those with as many people as possible, because there's a lot of people out here doing this work. So it's super valid.
You all will be receiving a survey after this call, and you will have an opportunity to tell us if you want to keep in touch, if you want to be part of a group that, informal information sharing. And if you are in fact a patient at CHP who would like to talk more about the clinical care side of this, you can reach out to Annie. You can see on this slide, aschwartz@chpberkshires.org. And I'm sure that Annie would be happy to talk to you further. Is there anyone else who would like to share an experience, offer a tip, anything you'd like to do? We've got a few more minutes, so feel free to raise your hand and talk a little bit more about this topic. We can hang out for a few minutes.
Also, if anyone has questions about the track too, those are welcome as well.
Annie, what was your recent book group? What book
We just did Dr. Jennifer Gaudiani's book Sick Enough on the medical complications of eating disorders, which is a highly recommend, and also take your time with it. It can be a little heavy at times.
Any other book recommendations that you've
Say
she's going up. She's got the talking head bookshelf behind her. That's great.
Our other book club book was Fat Talk by Virginia Soul Smith, which is incredible for anyone who has been a kid, has a kid, will care for kids in any way, shape, or form. Really incredible.
A colleague here of mine in my office recommended a podcast called Maintenance Phase. And he says it's a great, really interesting podcast on these types of topics. So I'm a podcast fan. I like to walk or, do housework and listen. So podcasts are great. And we can recommend some of these too.
Yeah, Maintenance Phase is incredible. One of the co-hosts is Aubrey Gordon, who's an incredible writer, researcher, and fat activist. She has a documentary called Your Fat Friend film, I believe, that is hopefully in circulation soon, but you can follow her on Your Fat Friend with YR to be more in touch with that if you want to check out the documentary. It's incredible. Yes, someone else is saying Christy Harrison's Anti-Diet, which is also an incredible resource, and Aubrey's What We Don't Talk About When We Talk About Fat. Yeah. For the kids people who have like middle schoolers or are former fat kids, I use fat as a neutral descriptor. This is a really, really beautiful book by Lisa Phipps called Starfish. It's written in sort of like prose format. I don't know if you can see that. It is a gorgeous book. It will make you cry and feel empowered at the same time.
Both at the same time. It's great.
Mm-hmm.
Okay. Is there anyone else? Last chance. Okay. Thank you very much, everyone. This has been great. We hope that you come away from this with some feeling a little differently about how you can take charge of your care going forward and how you can speak to healthcare providers about your health. And we wish you all the best, and please watch for our follow-up note so that you can let us know how we can keep in touch with you on future events, conversations, book groups, anything else we find out that might be helpful to you. So thank you very much. Thank you, Annie. Thank you, Kim, Darcy, for technology support, and everyone for joining. Thank you so much.